everyone. Thank you for joining the Texila Thought Leadership Series. Welcome to the webinar on At the Frontline, Public Health and Health System Challenges. I take immense pleasure in welcoming the moderator for the session, Dr. Vijay Kumar Rajaratnam. Dr. Vijay Kumar has 29 years of experience with 14 years of education management experience, backed by 15 years of industry experience in multilinguistic environment. He has the ability to inspire and lead a team of professionals with analytical capabilities to handle challenges and modesty to share success. At Texila, he is a part of the leadership team, steering the university from the front and achieving milestones. He has been instrumental in building a strong academic network in Zambia and raising the quality benchmarks for the university. As Deputy Vice Chancellor, he continuously strives to a high satisfied student community and facilitates in maintaining high standards of academic environment. We welcome you, sir.
Thank you, my dear colleague. Ladies and gentlemen, welcome to this Texila Thought Leadership Series titled At the Frontline, Public Health and Health System Challenges. This topic has been chosen especially after 6 months that we've been experiencing in this pandemic situation. And our public health workforce, be it the doctors, the nurses, the pharmacists, the clinical technologists, the clinical officers, how much they've been battling this pandemic right at the front line and the challenges that they've faced and how they've been overcome. Resilience at the front line, some of the takeaways that we will be discussing and elaborating. Engage the frontline healthcare workers with their experience so far and understand their challenges. The rising health workforce, the crucial role of the health workforce in treating the disease of the affected patients, challenges facing the health systems, understand the roles and responsibilities of health systems in making high patient recovery rates, delivering quality health services, making the audience learn the strategies to improve the quality of care given to patients, addressing the mental health challenges of the workforce, explore the mental health difficulties faced by the frontline workers to deal with patients, enabling proper health services, learn to develop a strong commitment with defined principles towards saving the lives of patients. My dear colleagues, and some of the healthcare workers who have joined, we salute you all and we present this webinar for the battle that you've been battling for the last 6 months for. Healthcare workers are toiling countless number of hours since the global outbreak of COVID, otherwise known as the SARS-CoV-2, which has been recently declared as pandemic. Healthcare systems across the world, developed and developing nations, are put to the ultimate test and are under tremendous pressure to limit the spread of the novel coronavirus, and majority of this responsibility is shouldered by the frontline healthcare workers, effortlessly putting their lives on the line in order to do so. Unconditional and unprejudiced servitude is one of the principal health workers around the world adhere to, especially in the time of peril as the present day. The exposure to the virus causes debility, morbidity, mortality, but to a significant extent also leads to immense physical and psychological exhaustion. This breakdown has led to health departments and ministries reaching out to retired medical staff and those who spend more time in research to return to clinical work to tide over the mounting pressures on the health system. It was evident from all over the world, hospitals and healthcare facilities were reporting deficient supplies of personal protective equipment and other vital necessities. Those working in the emergency and intensive care units are particularly and disproportionately affected when they are the ones who need it the most. In addition to battling endless hours, draining shifts, staff shortage, deficient supplies, most are isolated from their families, affecting them emotionally and physically. Anxiety, depression, denial, insomnia, anger in the face of this pandemic will take a toll and is taking a toll on the health service delivery, adding to the increasing morbidity and ill health. These mental health problems are not only affecting healthcare workers' clinical decision-making ability, judgment, attention, and understanding of the disease, but also having a lasting impact on their overall well-being. There's a need for their safety. Without adequate protection, COVID-19 mortality may be high among healthcare workers and their family in Africa, given limited critical care beds and difficulties in transporting ill healthcare workers from rural to urban care centers. Much can be done to protect healthcare workers. However, the continent has learned invaluable lessons from Ebola and HIV control. Sustaining safe and quality care in the SARS-CoV-2 pandemic hinges on the health and mental well-being of the frontline healthcare workers. Mental staff face exhaustion, difficult triage decisions, separation from families, stigma, and the pain of losing patients and colleagues, in addition to their risks of infection. At this juncture, I have with me two very learned colleagues and practitioners in the public healthcare. Ladies and gentlemen, I am honored to introduce the first panelist, Dr. Abiodun Oleiwa Paul, who's an international public health specialist with over 12 years experience in public health survey, laboratory management, coordination, and implementation of reproductive health and HIV/AIDS, TB, MNCH, community programs in developing countries. He has demonstrated expertise in the development and implementation of HIV/AIDS national strategy plan and policy, laboratory quality management system, and attainment of its expected outcomes and doubts. He had over 50 scientific publications. Dr. Abiodun has excellent transferable skills in program leadership and management, public relations, communications, negotiation, and capacity building. He is also an adjunct faculty at Texila American University. Dr. Abiodun earned his doctorate degree in public health from the University of Nicaragua, South America, and is fluent in English and French. Dr. Paul, a warm welcome to the webinar.
Yeah, thank you for having me. It's a privilege to be here. Thank you.
Along with Dr. Paul is another learned medical professional, one of the first in Zambia, Dr. Isaac Sakala, a medical doctor based in Lusaka, Zambia at the Levi Banamasa University Teaching Hospital, who's also the registrar in orthopedics and trauma surgery. He's one of the first graduates of Copperbelt University School of Medicine. He also holds a postgraduate certificate in leadership from the Institute of Directors. He's the current president of the Resident Doctors Association of Zambia and was treasurer of the association in the previous executive. He's also currently holding a member of the executive for Zambia Medical Association and sits on the board of Zambia Medical Association Cooperative. A warm welcome, Dr. Isaac Sakala.
Thank you very much, Dr. BJ. I'm glad to be here. Thank you to all the other attendees of the session.
Let me start with Dr. Paul. Dr. Paul, the current pandemic situation and the efforts put in by the healthcare workforce. A broad perspective from your thoughts, Dr. Paul.
Yeah, when you look at the way the pandemic, the expectation to Africa region, I'll be speaking from Africa region now this morning. The expectation was actually very high. There was even a prediction to say Africa is going to really very, very bad with COVID response or COVID outbreak. But should I say, fortunately or unfortunately, the situation was not the expectation of the international community in terms of what is happening in Africa. Currently, when you look at Africa CDC, which I'm working closely with, I'm also in the country, also coordinated the sample referral network for COVID-19. You agree with me that across all the 5 regions in Africa, our case facility rate is still very, very low. We still have a very, very low facility rate compared with what the world has reported. I know globally we have about 3.1% case fatality rate as at 15th of September this month. Of course, we all agree that it's over 2 million people, 2 million confirmed cases, and approximately 37,000 deaths have been reported globally. But to Africa, to our amazement, we still discover that Africa is really doing a lot in terms of response, just like maybe because of the experience of the Ebola. We've had a lot of outbreak in the past in Africa, cholera outbreak, Ebola outbreak, and many other outbreaks that have been very, very effective. And when you look at the health system strengthening for Africa, for example, talking about the building block of health system strengthening, where all the health system of the Africa is resting upon, right from human resource for health, which is one of the priorities we'll be talking about today. You agree with me that we don't say there are really, really deficient of human resource for health in Africa because from some of the studies I've seen, we have a lot of health workers in Africa, but some of them are not really employed, or some of them are on private practice. And that's the response holistically has been very, very productive. Following the Africa CDC to see the response of the COVID across all the 5 regions of Africa. As I said, for Africa, the healthline workers, just as we rightly mentioned, play a lot of critical role as a frontliner to really see that things are normal. That have actually caused a lot of increase in responsibility. That have actually caused a lot of time. People have to work 24 hours to meet up with challenges. But I've not seen this case overwhelming, because when you look at the 55 African countries that have been reported so far, we just have just 1 million plus cases, and our case fatality rate is still around 2.4%. The death was around 34,072 deaths, which South Africa is accounted for more of 1/3 of the total deaths. Nigeria is just around, it's less than 2,000 deaths. So we've really go a long way by really, but practically from what I've seen, the health workers, the frontliners have been facing a lot of challenges. And of course, the challenges are ranging from the frontliner testing them as a priority, or getting a vaccine for them, because some of them have to be on hydroxychloroquine as recommended by WHO. And PPP has also been an issue, provision of personal protective equipment to all frontline workers to protect themselves has also posed a lot of little challenges that we face. But of course, all right, so we'll be providing things to get this done. And the issue of self-isolation, social isolation, quarantine for frontliners is also a major concern, because a lot of people are depending on them, not for COVID. Don't forget, Africa has also been suffering from ATM, from HIV/AIDS, malaria, and tuberculosis, which people have to, one person maybe, when you look at the workload analysis, maybe one health workers to about 15 to 30 patients. But in Africa, it's not the case, because some people are not really employed, some are also on private sector. So self-isolation has been a major challenge. Social isolation has also been a challenge, and quarantine, because people have to manage the little resources they have. And another thing I would like to talk about is the training. The capacity needs to be built. The health workers need to really look at their capacity critically, and they also need to
Dr. Paul,
understand.
Dr. Paul, just let me interrupt you for a second. I'll come back to that topic in a few moments. Let's hear what Dr. Isaac has to say about it. By the way, appreciation for that low fatality rate, just keeping it at 2.4%. But Dr. That was maybe based on the experience that we had from the Ebola pandemic in 2015-16. Dr. Isaac, but Zambia was very well secure during the Ebola pandemic. Zambia was not affected at all. I think just 1 or 2 cases we had in Zambia. Am I right? Correct me if I'm wrong, Dr. Isaac. So based on that experience, maybe the other countries, maybe the Western Africa or Eastern Africa is more equipped and trained to handle pandemic. How do you see the health workforce from Zambia handling such a pandemic? Okay, fine. Malaria, HIV, all these have been a yearly affair, but not a pandemic of such nature as COVID. So when COVID hit Zambia, how did the health workforce handle it, their mental resilience? Dr. Isaac, can you share your thoughts on that?
Yes, thank you very much, Dr. Vijay. I must mention that indeed Zambia was not affected with the Ebola outbreak. And unlike our friends in the Western Africa who were at least more traumatized to pandemics, for Zambia, despite having had an outbreak of cholera 2 years ago, I think it was not of this magnitude. So as a country experiencing a pandemic this magnitude for the first time, it was quite a big challenge, I think, for the country and for the healthcare workers and the health system as a whole. I must make mention that among the many challenges I think the country faced are quite similar to what other countries as well have faced. I think the picture we're bringing out may represent the region at large, Southern Africa, to be specific, because I think most of the challenges we're facing are quite similar. And like I mentioned, I think the challenges range from those affecting the healthcare workers and the challenges affecting the healthcare system as a whole in an effort to fight COVID-19. And maybe to talk a little bit more on the healthcare workers, I think most of the challenges the healthcare workers I think face in Zambia are similar to what you mentioned. I think our healthcare workers, I think, have suffered a lot of psychological stress and from stigma, the trauma of having to go in and risk infection, and a good number of healthcare workers have actually got an infection with COVID-19, and some have even succumbed to the disease. So it's been quite a trying moment for the healthcare workforce in Zambia, particularly, especially looking at the comparison of the population they have to cover. So what I was actually saying is that I think the pandemic has had a huge toll on the healthcare workers here in Zambia, and because already we have fewer number of healthcare workers in Zambia against a huge population they have to attend to. And pandemic, it really affected the healthcare workers in that they needed to increase the number of hours they needed to work. They needed to sometimes relocate from their normal stations of work. They needed to sometimes have to isolate in isolation facilities. And it also logistical issues, and it also presented a lot of
Exactly, a lot of challenges for handling the healthcare workers who would otherwise be in normal working conditions. I just want to raise a question here to both Dr. Isaac and Dr. Paul. So this is a difficult situation and a different situation. So at leadership level, how are we training our healthcare workers in coping up the stress, professionally as well as personally, because when you, as you rightly said, sometimes they need to be isolated both from the workstations and as well as from their families. Sometimes they're near and dear ones, so they would be losing it. They need to balance that personally and professionally. So how are we training them in coping up this mental stress? Dr. Paul, maybe you can start off and then Dr. Isaac can join in.
Yeah, thank you, Dr. Vijay. Coping with the stress during the COVID pandemic for healthcare workers is very, very critical. It's very, very important. I was reading through one Canada, I think, laboratory association, whereby they were trying to carry out a survey, or more like a study on some of their health workers. And the outcome was that, number one, a lot of them were, mental stability. They were really, really badly, affected in terms of, because some of them have to work extra hours. They've never actually worked that kind of hours before. And they also felt that apart from the survey and research, the health workers is going to also have an impact on their life expectancy, because when somebody's health is already altered, the such particular life could be cut short. And of course, you know that one of the leading diseases in the world for non-communicable is cardiovascular diseases, and this is actually majority of them are associated to stress. So when you look at that from that angle, one of the things I feel that the government is doing is to ensure that we bring aboard some healthcare workers, some of them, like you rightly mentioned in your introduction, some that have already retired. They have to bring them back and say, okay, you've retired, but you are well experienced, you come and help us respond. That has been a practice in Africa for years. And bringing those retirees back to work, especially in the time of epidemic, pandemic, or any form of outbreak. Number two, things that the Nigerian government has been doing that I've seen is to do what we call task shifting. Task shifting means there are some responsibility that is for core professionals, but there's some people that can see put through or maybe try to guide that can actually more or less provide some support, some level of support. And then we have a task shifting policy in Nigeria whereby
any specific programs that we are running, Doctor, any specific programs that we are running for the welfare of the healthcare workers? Specific programs?
I'm relating this to COVID.
Oh, okay.
All what I'm saying is on COVID. All what we have been doing is on COVID. We have the task shifting. We have bringing back the retiree to support. Since we have the task shifting, and we also increase, like I saw adverts sometime whereby we have to brought a lot of nurses abroad, on board from various places. We have to second some from their various location, because some states are affected more than one state. So some adverts were actually aiming at bringing some of those low affected environment to where they are mostly affected. And right there, we have more staffs that can, because we look at the workload analysis, you look at the number of hours this particular frontline worker is going to work compared with the workload. So you have to bring some people from a less affected environment that have less work to do, not less work in code, but in terms of
from
COVID,
the administrative section to the clinical side.
Excellent. So the same thing will be applicable to doctors, to nurses, to pharmacists, to medical laboratory scientists that are doing the testing, and even the social workers that have to do with the patients. So, and these have actually been very, very helpful. And over the time now, the peak is already going down. So that has been very, very effective. And we call some people corpers, we call them National Youth Service Corps. These are fresh graduates that the Federal Ministry of Health also incorporates into the COVID response in a way that they are available, they are just young, they are available, so they can help in data documentation, they could help in identify some of those patients with the case definitions, and of course the laboratory diagnosis. So these are just the few things that have really worked for us in Nigeria. Over.
Fantastic, fantastic. Dr. Isaac, your experience in training the Zambian health healthcare workers in handling the stress, handling the resilience, and handling the pressure in terms of fighting this COVID? Dr. Isaac?
Thank you very much. I think in our approach, I'll talk about the efforts that the professional associations have put in, and then I'll also try to identify a few measures that government has put in trying to reduce the stress level. First of all, my association actually deals in issues of welfare of doctors in this country, and this has been a main issue of our focus as an association, especially at a time when we are fighting the COVID. From the doctors that suffered the COVID-19, we realized that these doctors needed to be here to share their experiences and some of the challenges they faced as being patient of COVID-19. So what the association has done has created a platform for the doctors to share their experiences, their challenges, especially sometimes we have had situations where these doctors do not have proper, in terms of the facility, the state of the facilities they're in. So as an association, we've come in to create a platform where, we put them in one basket and create a support group where they share their experiences and see how us as an association can come in and support them. Furthermore, after learning a lot from, some of the experiences they were sharing, we further on planning to create a task group. And this task force group is meant to, provide to provide solutions to some of the challenges that, the doctors experience while suffering from COVID-19. And in this task group, we've, planning to put in, key stakeholders, for example, us from the professional associations, to bring in on board people from the ministry, and to bring on board part of management in various hospitals where these healthcare workers and doctors particularly may fall in. So we are trying to put in all these measures to try to, lessen the burden, because from one of the doctors actually is where they explain to say, when you're suffering from this disease, it's as if you're about to die. It has a lot of psychological impact that makes you think you're about to die. So we have gotten a lot of touching experiences and, testimonies from the healthcare workers at the front line, and we are doing everything possible to ensure, we lessen the burden in terms of the psychological trauma and the impact they have as they suffer from COVID-19. And talking about what government trying to, dialogue with government, I think to come in through, more especially, I think in terms of incentivizing healthcare work, exacerbating this stress is a lack of incentives in terms of maybe logistical issues as they suffer, they're in isolation, they require some type of incentive. So we are in continuous talks with government to see how they can incentivize, these healthcare workers battling COVID-19. And then I think the other thing that I think government has responded to is an attempt to increase the the workforce in the healthcare sector, considering the demand increased when COVID came. So we were in touch with government, and I think since the onset of COVID-19, I think they've responded. I think they managed to employ about in excess of 350 doctors and more than 2,000 nurses, which kind of buffered up the stress, I think, that was being put on the healthcare workers in general.
Fantastic, Dr. Isaac. Nice to know that the government is taking some initiatives to incentivize the healthcare workers, give them some incentives or give them some financial benefits. No matter, no finance or no money can give them solace in terms of mental stability or resilience to handle this COVID. But nevertheless, the government is taking some initiatives to appreciate and recognize the efforts. Dr. Paul, anything from your side across Africa similar to what Zambia has done here?
Yeah, it's the same thing, because we usually learn best practice through the Africa CDC platform, whereby all the 5 regions come together to look at what we're doing. And of course, as a level of the regional West Africa, we also learn a lot of best practice from ourselves, which have also participated in a lot of their meetings. I think one of the things that we also need to make reference to is the sample referral network, which also reduce the burden on healthcare workers. Samples are picked from hub to spoke, or let me use from spoke to hub, whereby from the initiating laboratory to testing laboratory, which is the PCR labs. So that has been a practice to really reduce the burden of testing across the country. And another thing that we need to also know that maybe I was very silent about was training, different level of training, facility-based training, the on-site based training, the clinical trainings, various form of trainings on even on PPE, various form of training for all the healthcare workers at different level, just for them to manage effectively and so that we can have a positive outcomes. I think these are the basic things that I would like to mention. That typically we will be doing that effectively, sample referral network, and we leverage on national integrated sample referral network, which is with the aim of harmonizing. We already have that existing in the country for HIV, for TB, for CD4 samples, EID samples, and that have really played a lot of roles. So it has really reduced burden on the system. And for area of psychology, we'll be having a regular meetings to assess people. People have been taking time off of their duty to rest. And by and large, it has been very, very productive. Over.
Oh, thank you. Just a small message to my panelists. This particular webinar, which is being recorded, would also be telecast again for the general population, for a larger audience, some of them who could not connect today, so for a general audience. So my one last question to both my panelists would be seeking opinions on, yes, the government has been playing a fantastic role in conjunction with the CDC and WHO, and at the same time, training and educating and supporting our healthcare workers, who are the greatest medical warriors right now. But at the same time, there's another dynamics, that is the patients and the public. Now, what is the message that you want to say to the patients or to the public, especially in such a very, very dynamic and volatile medical situation? We have handled it great. In the last 6 months, the continent as a whole has handled the situation fantastically. And that's why we have a very, very low fatality rate and a very high recovery rate. But at the same time, we need to address, let's take this opportunity and address the patients and the public also. And a message for them, please.
Yeah,
Dr. Isaac?
Okay.
Oh, you maybe, Dr. Paul, go ahead.
All right, I think the message for the public that people need to know, the battle is yet not over. This is an enemy, an unseen enemy that we're fighting. And one of the most difficult battle or war that you can fight is to fight an enemy that you are not seeing or you know little about. The world is still evolving. There's a lot of scientific discovery. There's still not vaccine. There's still not, cure. Even though people, publications have shown, scientific publications have shown that early stage of using hydroxychloroquine has been very, very effective. But people have to also be very careful because Africa is suffering with a lot of antimicrobial resistance. So we need to really be very careful in terms of self-medications. So people should listen. People should also ensure they wash their hands. They have this social distancing. People should also ensure that all the safety protocols, safety guidelines as laid down by the government are properly followed. Over.
Dr. Isaac? Being in the front line, sitting at one of the premier hospitals in Zambia, you must be facing a lot of heat and fire from the patients.
Yes, yes. So I think my message to the patient and the community at large is that, the virus does not move. It's the people that move and spread the virus. And unfortunately, I wish it was a situation where the fight or the victory against COVID-19 was to be possible by the effort by the healthcare workers alone. Unfortunately, the situation where we're in now, I think for us to win this battle, it requires efforts from both ends, from the healthcare provider and the people. So I think we are urging the people that, as we go out there and, fight COVID-19, it's important that everybody plays their role. Whilst the healthcare workers are doing so much, they are putting in a lot of effort. They have doubled their shifts. They are, fighting psychological trauma to go and see if they can defend the human race. Our call to the public is that let them also play their part. Let them reduce unnecessary movements. We want to see I think the public adhere to the health guidelines that have been put in place. And together we can fight. Further, again, I think on the part of governments in Africa and the world over, I think we want to see a lot of reinforcement of these guidelines. I think a number of guidelines are there, but sometimes people are not following. So what we want to see as healthcare providers is that what is government doing to ensure people adhere, to the guidelines. It is only when all the stakeholders put hands together that we will win this fight. It is not a fight that can be won by healthcare alone, or the community alone, or the government alone. It's a fight that requires everybody. So I think for me, it's a call to everyone out there that let's join hands and let's win the fight against the COVID-19.
Yes, that's a very strong message, Dr. I said, let's join together, all of us, the government, the healthcare workers, and the general public. If all three of us join hands together and work, only then can we defeat this great enemy. Yeah. Thank you so much, Dr. Paul and Dr. Isaac, for having this open thoughts of yours, especially during these difficult times. I think I'll open the floor. We have some participants in the webinar here. Maybe we'll open up the floor for any questions if they may have, or any thoughts also they can share. So looking at the overall discussion that we have, we must definitely be saluting the great effort being done and rendered by the healthcare workers in spite of their stress and trauma that they must be going through personally and professionally. But in spite of that, the amount of dedication and commitment, even otherwise, healthcare workers has been most noblest profession. But now during this pandemic, they've risen the few more notches on the higher, both on the administrative side and on the clinical side, both on management and delivery. The healthcare workers have risen great levels across the globe, and there has not been one incidence where healthcare workers have been abused or they were accused of any misincidents, because they've committed and it has been in their blood and their profession. We definitely at Texila American University, we take this great opportunity of saluting all the healthcare workers. And I also thank the panelists, Dr. Isaac and Dr. Paul, in spite of your very, very busy schedule handling this pandemic, to share your few moments and your thoughts. Thank you so much, Dr. Isaac. Thank you so much, Dr. Paul, for joining us. Definitely, we would look forward to having more deliberations at this very, very innovative thought leadership series called the Texila Thought Leadership Series, launched by the Texila American University. Thank you, everybody. Thank you for joining. Thank you once again, Dr. Isaac. Thank you, Dr. Paul. Over to my
thank you for having us.
Thank you for having us. Thank you so much. Thank you.
Yeah.
Thank you.
Thank you. Thank you, everybody. Thank you, Dr. Paul. Thank you, Dr. Isaac. We'll meet again in better times.
Thank you so much for having me. Yeah.
Thank you.
Thank you. All right. Bye.